Good morning, good morning. Welcome to another product webinar with Exxon Health. And happy Wednesday, as I normally say. Are you, as you're joining, I should say, could you just drop a 1 in the chat to let us know that everything's working as we want it to be? Sound in particular, because we've had a few issues this morning. I won't go into them. Personal problems. Lorna, thank you very much. Anybody else? Anybody? Yes, lovely. Okay, Karen, Vaughn, lovely, fantastic. Lovely to see some familiar names and some new ones, in fact. That's always nice to see. Right, well, we've got a good one for you today, but I should warn you, right from the outset, I think, it's only fair. Today we're going to be a little bit more interactive than normal. So if interactivity is not your thing, today might not be for you. But we're not going to put anyone on the spot, so I'll reassure you with that. We are looking for a little bit of participation. Lindsay's nodding along, right on cue. Very good. Nice and gentle. I promise we're not going to be too taxing. Before we get started, though, the usual bit of housekeeping. Firstly, to say the call is being recorded for prosperity and sharing. So if you need to drop off at any point, do not worry. We will be sharing a link in the next couple of days. We're aiming to keep this to no more than 30 minutes. So it's just a snapshot in your day, just time to down a cup of tea. And second of all, of course, we love questions. So do please pop them in the chat whenever you feel the urge along the course of this webinar, and we'll get to them when we can. Right, enough of all that. My name is Lucy Glynn. I am the Community Manager here at Exxon Health. And with me today on this webinar, we have, are you ready? Drum roll, please. The Queen of the Academy, a Master of Learning, the one, the only, Lindsay B. Welcome to the show, Lindsay B. How are you doing?
Thank you. I'm good, thanks. A lot to live up to there. Thanks for that.
Yeah, no problem. I do like to build my guests up to the very highest pinnacle so that when the questions come in, people are very expectant. Now, Lindsay, last month, you were a very busy bee. Yes, I wrote that pun myself. I apologise, but I have been waiting all month to say it. You were responsible, of course, for our national, hang on, let me get this right, our National Access Optimisation Programme webinars. Not easy to say, by the way. Thank you very much for that. For those that don't know, who are on the call, we ran a webinar every single day for June, throughout June, focusing on the 4 key features that underpin our Access Optimisation Programme. I am just going to put you on the spot, Lindsay. What are they again?
They are patient callback, soft phone usage, so the phone bar, clinical systems integration, and call routing.
Very good. Very good. You didn't know I was going to do that to you, did you? That was. Are you sweaty now? We also, of course, ran a bonus session around management reporting, which was, I think, turned out to be our most popular session. Is that right?
It did, yeah, it did. The stats are here, look, very interesting.
Fantastic.
That was the front runner.
It was. I thought it was quite interesting. I mean, I'm going to just be really honest here and say when we launched these webinars, I was not confident that we were going to get the uptake that we did. I'm putting it out there. I don't mind laying myself bare. So it was fantastic, I think, to get the response that we did. But let's ask the audience. I mean, pop a 2 in the chat if you attended any of the webinars, 1 or more of the webinars last month. I'd love to know. Just a number 2. Goes like this. Yes, Terry, thank you very much. Graham, anyone else? Yvonne, Renee, brilliant. I mean, that's fantastic. So we did have a few. That makes sense of the numbers. The objective, of course, of these webinars was to encourage as many practices across the country as possible to use these features that Lindsay very kindly listed out for me to their fullest potential. And as a result, reap the rewards. And you did, you came out in the droves. So we're thrilled to say that over the course of the month, we welcomed 1,600, or over 1,600 registrations, and 830 people turned up to the live sessions. We received some phenomenal feedback, and those numbers really do speak for themselves. You can see the breakdown right here. And the team that was able to deliver those webinars delved into the benefits of each function and certainly provided some practical insights on using them, explaining perhaps why you at home would like to do the same to get the most out of them. And I think what was really great was when they opened up at the end to the Q&A. So they opened up at the end of every webinar to the Q&A from the audience. And because we had such a variety of an audience, we got some really great questions, some of which were answered on the spot, of course, others of which we had to go away and have a bit of a think about and reply. But in a moment, we're going to look a little bit in more detail at those questions, particularly the most common ones that were asked across the sessions. But I think it's worth saying just at this juncture that we have sent out an email to everybody that registered for the June webinars. So you should have received that. Do let me know if you haven't. And within that email, there is a link to the Academy page where everything is collated. So that's the webinars on demand, so you can watch them at your leisure, and of course the Q&A. Each of those webinars was only about 30 minutes long, so you've got time to, as I say, sit down with a cuppa and watch them back in your own time. And I think the sort of the positivity that's come through from them is around motivation, because if you watch those webinars, it's surprising, isn't it, how motivated you get in embracing those features within your Surgery Connect system and making the most of them. So that was a really good takeaway from me. Here I am, flippantly using the term access optimization program like it's going out of business. I'm not sure everybody on the call knows exactly what that is. So I just wonder, Lindsay, whilst I'm putting a link in the chat to the Academy, whether you want to dive in and talk a little bit more about the program, what it offers, and why we're doing it.
I do. That's amazing, because I've just got the slides to be able to do that. So
coincidence, I think.
So
not.
Here we go. So yeah, the Access Optimisation Programme, it really is there to support you, the practices, to get the most out of digital telephony, and it's aligned nicely to the requirements of the NHS Primary Care Access Recovery Plan, commonly known as PCAP, and which is much easier to say. The programme, it enables patients to access care much more easily using those features that we've mentioned, and it transforms, the aim is to transform the patient's experience and really help to ease the 8 AM rush, which is top of our agenda at the moment. So we provide ICBs and PCNs with rich anonymised telephony data across their patch, empowering them really to make informed decisions based on that data and to help all their practices improve that overall access to your services. So as I've mentioned, I got them right, thankfully. The 4 main features covered are patient callback, advanced clinical systems integration, Softphone Usage, so the very exciting phone bar within Surgery Connect, and call routing. And the reason we pick out those features is really because they are the really advanced areas that when you implement them fully and use them to the best of their ability with some clever thought behind them, they can really start to have a positive impact, not only improving patient access, which is the crux, but also transforming some ways of working for you within the practice, saving you time and money. So really it's a win-win situation. Let's just do it. And as we mentioned, we've got that 5th feature, which is management reporting, and that's there to help you run reports to see the differences and the changes, the differences of the changes that you've made. By implementing those features, you can use those that data to make even more decisions, tweak the features in how you've implemented them. So that's really there to support those features and help you see the impact. So once you get used to analysing your own data and thinking of it as continual improvement, you're off, really. There's no stopping you. So that is a bit of an overview of what AOP is. And we call it AOP because it's so much of a mouthful. But here's
I thought it was because you were from the north. I helped me to hook.
Oh, no,
I've not heard that all before. Right, back in the box.
So just a bit of top level information really on what is available through the programme, and that is around consultancy and training really across these 3 areas that are on the screen now. And they all have that focus on those 4 to 5 features that we keep mentioning. So it's a great opportunity that we want all of you to take up and start to see the benefits to the patients and the surgeries as a result of it. So just having a look at the detail, it is on our Exon webpage as well. Hope Lucy might be able to just drop that link in the chat for us. Put you back on the spot now.
Of course.
But just briefly, the data analytics and consultation element is basically as being able to provide a full data package to the ICBs based on key metrics that provide insight into the adoption of those features in each practice across the region. So the data is anonymised or it's aggregated at PCN level, and it helps to identify where further support is needed. So it includes 2 review meetings in the year where we'll meet with the ICB, talk them through the data, what does it mean, what can we do to help make changes. Andy beat you to it. And it also includes the provision of quarterly reports, so the data will send that quarterly to the ICBs for them to track. Like I've just mentioned, you can do at surgery level, they can track the changes through the data and see where the improvements have been made. So at PCN level, it's all about training internal champions, or train the trainer if you like, where we can provide 2 days worth of face-to-face train the trainer courses tailored around those 4 to 5 features of the programme, and again informed by the data in the reports. So participants are usually identified and agreed with at the ICB, but in most cases it's likely to be digital transformation, I can't say it, DTLs, and your PCN managers who play a real key part in the adoption of cloud telephony. It makes sense that they're upskilled in those areas so they can have really good conversations with the practices. They're geographically consistent and they can facilitate that best practice to get the most out of the features. So that's the idea there. And then at surgery level, it's all about a practice adoption, really. So there's lots of resources that are already out there and available for all of you already. Even before you go live, you have access to various things. So these include things like a named relationship manager for each practice, access to all the articles and detail of the system on the help centre. There's training videos, there's the academy with the e-learning courses, and there's webinars that can be attended. And in addition to that, just to help with faster adoption, if required, we can come out and do face-to-face training, or we can do virtual online training to really help you adopt the features. We've also got an AOP related webinar catalogue with lots of titles in there that will help. So we're throwing it all at you. There's lots of information.
And I was just going to stop you there, actually, because that's exactly how it feels. You know, there's such a wealth of information out there, and it's almost exhausting just reading it out. So just, you know, if you're starting out in your Surgery Connect journey, what would your advice be as, you know, product manager for the academy? Where would I start in just getting to grips with everything I need to know about this system?
Well, I'd definitely attend the session. So when you're on board in the amazing training team here, and the build team will run some sessions for you to join, that's your key starting point. And then in the background to that, we've got resources where you can go and self-serve. So if you're particularly interested in the stats and the user console, then go on the help center, have a look at the articles there. But to really consolidate your learning and to have a little test and check yourself, then I'd go on to the academy, the platform, where you can go through an e-learning course, little bite-sized chunks, learn the bits that you want, do a test at the end, and get a certificate. Who doesn't love a certificate?
I mean, everybody loves a certificate, that's for sure. I should get one just for being here. Right, and Valerie actually has come up with a fantastic question. I'm going to throw it at you. Training internal champions, is this free?
There is 2 days that we can offer free of charge, and that is based on the 4 key features. So it's really specific to access optimization. If you want anything different to that, if you want to tweak it, make it specific to your area, you know you have particular queries in one particular area, then we'll look at a bit of a cost model to sit behind that. But yeah, there is a certain element of it that is available upfront.
I mean, I think it's all fantastic. I think it's I've never come across an organisation that offers software like this that is willing to push so hard to make sure that you're getting the most out of it. And I think that's the overwhelming sort of or underlying piece of this is what it's all about. So I think the key takeaways here is the academy is a great place to start. So whether that is going to the lunch and learn, or whether it is just having some training with your what's the relationship manager named relationship manager. Yeah. Thank you. Yes, my mind's gone blank. You know, and then, as Lindsay says, dive into the e-learning platform, come away with a certificate, because that raises your confidence, and it also gives you opportunities, doesn't it, to play with bits of the system or some of the features of the system and experience that without having to actually go into your own system back end and play with things there. So all really worthwhile doing. And if you're in any way confused about what's out there or where to start, I think get in touch with your client relationship manager and have a conversation. But there's loads out there, so make the most of it. Sorry, I know that I'm stopping you mid-flow, so do get back to your presentation.
No, that's fine. I'd finished on that slide anyway, so I was just going to revert back to my favourite topic, which I can never say, so we call it PCAP. And it's just really to say that everything that we do, all those training interventions that we've just mentioned, we really try to make a tangible link to the specific requirements of PCAP to help you. So this is an example here of how the feature clinical systems integration can help you move towards improving access for patients, and in doing so meeting the objectives set out by the delivery plan. So you'll have probably recognized that these bullet points here are actual objectives, the specific objectives from the plan. And the recent webinars that we did and the e-learning courses, they're all very good at making that link for you. So throughout all the materials, you will see that we have this little blue icon down here on the right hand side where you see that is going to give you information about how this particular feature is linked to meeting the requirements of PCAP, and as well actually the capacity and access improvement payments. So there's very tangible links in there. So are we ready?
I like an icon that makes it really, oh yes I am. I was just going to say I really like an icon that makes things quite obvious for me. Yes, the little blue icon.
Get used to seeing them. Yeah.
Good, okay.
Cool.
Ooh.
Right. So here we go. It's time to get interactive, people.
Sorry, Lindsay, just before we move into the interactive section, Udin's come up with a great question. How long are the on-site training sessions?
They are half a day. Yeah, half a day.
And Jenny, I'm going to leave that one to Andy and Lorna to reply. I think the answer is no, we don't know yet, but it's not quite on topic for today. So we're going to get into our interactive section, and Lindsay is going to lead the charge.
Yes, let's see how this goes, dropping everybody. So taking it back to what Lucy said at the top of the session, we collated all the Q&As from the webinars throughout June, and especially for you today, you lucky lot, we're going to go over some of those Q&As now. So hopefully you'll get an idea of what others were asking. It's highly likely you've got the same questions yourself, and hopefully the answers. That's where we're going. So get ready for a bit of interaction. You're going to have to type. I might let Lucy explain how we're going to do this in a minute, but I guess the idea behind this is we want you to know that we listen to what you're asking and we do something with those questions. We want to make sure that we're giving you all the information you need to be able to answer the questions that might pop in your head on a daily basis when you're using the system. So it's good for us to know that it's relevant for you. So we're going to go through the questions. Let me just move the slide on. There's 5 to start with. It might be enough looking at the time. They're broken down by those 5 topic areas. How do you want to do it, Lucy? Before I shove the question up.
I think let's shove the question up. Let's see what happens, and we'll go from there. But basically, you're going to ask the question. We're going to see how many people can reply in the chat and how quickly you can do it. And I tell you what, just to make things a little spicy, yeah, go on. We'll offer a prize to the person that responds to the most questions with the correct answers. How's that?
Brilliant. Go for it. Okay. Right.
I'm not sure the size of the prize, but let's see who's competitive out there.
Cool. Okay. So the first question is on patient callback, and we were asked if a patient is in the virtual queue and the receptionist leaves her desk, what happens with the patient once they get to the front of the queue before that receptionist comes back? Anyone brave enough to type as an answer? I did have some music. Shall I try it?
Give it a go. I
don't think it's going to work. You can't hear it, can you?
I can't hear it now. Does it go did it dum?
It does, yeah.
Oh, Kate, so first answer. First in with an answer. I don't know if it's right or not. Only Lindsay can tell. Oh.
Okay, yeah, Sally on.
Kate's saying they wait until I can't read them fast enough. Crikey. People can type fast. They're removed
from the ones that I can see, there's a mixture of correct. There was one that wasn't quite right. Which was that one? I think. Let's give you the answer, put you out of your misery.
Please do.
Surgery Connect, as we know, is based on people. Everybody's got their own profile. And when you're at your desk ready to take calls, you're effectively logged in. If you go away and don't take yourself out of available, then it will the call will just eventually go around the system and to the next available person in the group. But best practice here is for you to put yourself on the status of do not disturb, and then it stops it ringing your phone to start with and takes it directly straight to the next available person in the group. So the call won't be lost, it won't sit there waiting, it will go to the next person available.
So I think it's safe to say that Kate was the first in with the right answer. What's the next question?
Okay, next question. We're looking at advanced clinical system integration now. And we were asked, do the patients require any software or app on their phone to access the video call and the photo sharing features? So this is where it sends a link to be able to join a call or send a photo. That one's saying no.
No, is the overwhelming response.
Yeah, this is a really valid question because it just shows that that you're thinking about the patient experience, costs and uptake. How's this going to impact everybody? Everybody's saying no. Everybody is correct. No, the patients don't have to download any third-party information or applications for these features to work on the phones. It just magically happens. It's not magic, but yep, cool. Shall we move on?
Yes, let's. But congratulations. I think that was Renee who was in first. Oh, God, it's getting competitive out there. Sarah, very passionate with her response, though. She shouted at me. Anyway.
Right, on to phone bar, Softphone usage. This was a question we were asked a couple of times. If the patient, so this is with regard to the pop-up, the patient pop-up that comes up when the call comes in. If it is not the patient calling, i.e. a child's mother or next of kin, do you just manually change the clinical record? Because that pop-up helps you to change the clinical record to the active patient. Okay, yeah.
All very quick off the mark. Confident in his answer.
This might be a trick question.
Okay, not far behind. Oh, me? Don't let me decide. Don't let me decide. That's dangerous. We've got a lot of yeses in the chat, though. I think the overwhelming response is a yes. Okay. Is anyone? So I love it. Sarah's coming again with a slightly different answer. Yep. There you go. Nice. Brilliant. I like it.
Well, it kind of is yes if, well, let's put the answer up, if they're not calling from the same household with the same number. So it's highly likely in this scenario that the child and the mother have the same telephone number in their record. And if they do, what the patient pop-up will do is it will put both those patients in the pop-up, and then you as the receptionist or the call handler can verify when you answer the call who is it you're calling about, and at that point click on the right patient and it brings up that clinical record. But if they don't have the same number in their records, then yes, you were all correct at that point. You would need to swap to the patient record manually.
Okay, so okay. I mean, it was fundamentally a yes, and when we're asking people to respond in the chat, I don't think they could have gone into that much detail at speed. So I think we'll accept the yes.
It was directed in one way.
Exactly.
Yeah. Okay. Brilliant. Okay. So the last one.
I'm on your side, guys. I'm on your side. Yes.
It's not the last one I thought it was. Call routing. So we did a session on call routing that covered lots of different features, but we were asked a lot about check and cancel because it's still a relatively new feature, which is amazing. So we were asked, how do we add the check and cancel appointments? So how do we make them available?
Oh, I tell you what, things just got interesting. We've got a new player in the mix.
Oh.
So how do we add the check and cancel appointments?
Yeah, I guess people are thinking when you first hear about check and cancel and all the appointments are available, they're thinking, oh no, gosh, I don't want people coming along and patient cancelling really important appointments like IMS or smears, that kind of thing. So we want to make that customizable.
Yeah, so I think we've got. Okay, we're going to have to tally this up.
People saying call flow.
We've got everybody saying call flow, X flow, one and the same. So we'll take both answers. I don't know if it's right though, because I haven't got the answers in front of me.
It is right. Yeah. So it is possible to specify which appointment types or slots are available for the patients to either check or cancel, and that is done through the tabs, the check and or cancel tabs within the properties section of the check and cancel block in Xflow. So correct to everybody who said within the call flow or within Xflow.
And a special shout out. I was just going to say a special shout out to Udin, who says Xflow in the first instance, but call support if unable to set up. Quite right. Bonus points for that.
Yeah.
I love a little elaboration. That's fantastic.
So that's great. Yeah, well done, everybody. Good. It's customizable. Obviously, there'll be certain appointment types that you don't want people to cancel or check. So very customizable. Okay, last one, management reporting. So the majority of our abandoned calls, this was one practice saying this, are those made before 8 a.m. when we open. Can we change the parameter of what time it starts reporting?
I mean, it takes me 2 minutes to reread the question. I don't know how people are responding so quickly. This is good. We're only in with a second super fast answer. I mean, I'm with Edward. Oh, a little controversy here. A little controversy. Okay, I think you've thrown a curveball here, Lindsay. Very good.
Okay, so it is possible to exclude those calls by looking at the per hour breakdown. So on that particular report, you can break it down to per hour. And then if you were to export that via a CSV file into whatever software you use for spreadsheets, then you can manipulate that data and really focus in on the hours that you want to look at. So it is possible with a bit of jiggery pokery.
So well done to Renee. And Graham, interesting question. Why do we actually care about abandoned calls?
Well, I've just put the little definition at the bottom there. So some of them may be genuinely they've given up, because the definition there is that they could have, let me read it. The case of when the caller rings in whilst the practice is closed or the caller does not respond to a menu option. So they jumped off before they even got to any decision or person answering or a queue or anything. It can be a good thing because they may have been directed to another service through your call flow. So it could be a good thing. But yeah, some people are, some people aren't.
Renee's fighting hard for this prize because she's also jumped in to say a really good point to ascertain potential demand. I guess if you're trying to illustrate the point, it's a strong factor. So yeah, I think that was very good. I think it was very good, very good. That so many have jumped in with answers and had right answers as well. In fact, I think the last question shows perhaps why the management reporting webinar was so popular last month. But yeah, I think that is pretty much bringing us up to the end of the webinar. We've just answered that one, Kunal. So to ascertain potential demand, but also all of the reasons that Lindsay just gave that I couldn't possibly try to summarise even if I tried. But yeah, it's an important start, I think, particularly if you are trying to paint a picture of the pressures that are put on the surgery in particular. Right, so I think just to reiterate, if you do want to dive into any of these Q&As in more detail, they are all now collated on the Academy website. So the link is further up the chat, but I perhaps can lean on Lindsay to just pop that in the chat once more so that you've got it and it's all there available before we drop off. So I suppose there's nothing much more. Nothing more. I can see it. Yeah, absolutely. Nothing much more for me to say other than to wrap up the call. So that is it from us today. Huge thank you to everyone that's participated. That was fantastic. I will collate the answers and come up with a prize and send it out accordingly. Rest assured, it will be worth your time. If you would like any further information on anything that we discussed today, check out the Academy website and the page that Lindsay's just shared. It's well worth a look. But you can also go through your client relationship manager or the training team if you'd like to delve into anything more with regards to training. We'll make the recording from today available to all registered attendees in the next couple of days with all of the relevant links as well. We hope to see you back on for more interaction next month when we do it all again around the same time. In the meantime, on behalf of all of us here at Exon Health, have a happy and healthy July, and we will see you next month. Take care, and thank you very much.
Thank you. Bye-bye.